Good afternoon, everyone. My name is Lorna Hankins, and I'm the Executive Director of the Kidney Foundation serving Texas. And it is my pleasure today to welcome you to another edition of the National Kidney Foundation's Facebook Live series. For today's discussion, we'll take a look at the issue of COVID-19 vaccines in the world of pediatrics. Today, we are very lucky to be joined by Dr. Brad Warady. Dr. Warady heads up the Division of Nephrology at Children's Mercy Hospital, Kansas City, and Kansas City, Missouri. Children's Mercy is recognized as one of America's best children's hospitals by U.S. News and World Report, ranking in 9 pediatric specialties. I'm also thrilled today to have with us Dr. Jennifer Schuster, an infectious disease expert who also hails from Children's Mercy. It's great to have both of you with us this afternoon, and I thank you for helping us talk through this very important subject. So why don't we go ahead and get started? And Dr. Warady, I'll start with you.
Great.
Please tell us why it's important for children with kidney disease to get vaccinated against COVID-19.
Well, just like for any children today, they're all at risk for infection with COVID-19. And so all children, again, of the appropriate age group, should be vaccinated to prevent them from, all the complications associated with the infection, not only because they could get infected, but because they can infect others as well. So that's critically important. I'm sure Dr. Schuster will speak to that. The other thing that I want to point out is that if we look at especially the pediatric transplant population, those children who are immunosuppressed, they're probably at even greater risk for having significant illness associated with COVID-19. So another important reason that population of children needs to be immunized. Dr. Jen, do you want to speak to this question as well?
Absolutely. We've known that children in general have more mild disease with COVID-19 than adults, but they absolutely get infected. And some children, including those with kidney disease, do get very sick. And we're seeing children who unfortunately are having long-term consequences. So whether that is long-term prolonged COVID-19, or what we call MIS-C, multi-system inflammatory syndrome in children, we do know that unfortunately children do have these sequelae of COVID-19 in addition to acute infection. And so really underscoring the importance that every eligible child, and especially those with kidney disease, be immunized when they're able.
So Dr. Schuster, then how does the COVID vaccine work in children with kidney disease to prevent infection?
That's a great question. So the vaccine works exactly the same as it does in children with or without kidney disease. So I like to think about the vaccine for those people who are into sports. It's like practice or training, or really any activity that we participate in. The vaccine takes a part of the coronavirus that cannot make you sick. So it takes just the spike protein, which many people have heard about a year and a half into the pandemic. It takes just that piece of the protein, and your body can practice launching an attack, if you will, against that spike protein. So it's kind of like football practice. You do drills, you warm up, you get ready for the big game, so that when you actually are in the big game, or when you are exposed to coronavirus, your body is ready and prepared to fight, and you have those antibodies and your immune system is ready to go because it's already practiced really well against that. Now, for children who have kidney disease and have had a transplant, or who are on other immunosuppressive medication, their body may need a little bit of extra practice. And that's why those children may need an additional vaccine for coronavirus.
And so you anticipated, Dr. Schuster, my next question, which was about children who've received a transplant or who are on dialysis. What are the added risks for vaccinations in that group of children?
So there's really no added risk for vaccination. What I think, and Dr. Ward, you may have more thoughts on the subject, is there's an added risk of coronavirus disease in that group. So we know that children who are immunosuppressed, just like adults who are immunosuppressed from a transplant, are at higher risk of severe illness from coronavirus disease. We also know that children who are on immunosuppressive medication or who have had a transplant may not respond quite as well to a vaccine. And so for those children who are 12 years and older, it's recommended that they get a third dose of the coronavirus vaccine. So the Pfizer vaccine, which is the vaccine that's approved for now children 5 and older, for children who are 12 and older who are immunosuppressed or who have had a kidney transplant, it's recommended that they get a third dose of that vaccine, which is a little bit different than a booster dose, which I'm sure we will probably talk about later.
Yeah, no, I agree. I think, as Dr. Schuster mentioned, children in general don't get as ill as adults do with COVID-19. And even the pediatric kidney population, in large part, does very, very well, much better than in the adult counterparts, even if they're infected. But to her point, the transplant population in pediatrics does have less of an immune response to the vaccine, just like in the adult population. And so, again, as in the adults get 2 doses and a booster. In children and adults who are immunosuppressed transplant patients, they should get 3 doses as part of their normal regimen. It's not a booster. And in fact, there's conversations going on now in the world of transplant as to whether some of these patients should get a 4th dose. And that hasn't been decided yet. And there's a lot of research going on about that issue. But 3 doses for sure should be given to all the children who are immunosuppressed, all the transplant patients, or children with other disorders that are receiving immunosuppressive medications.
Okay. Before we continue the conversation, I want to just remind our viewers that we would love for you to go ahead and put your questions in the chat room, and we'll have an opportunity at the end of this conversation to get to some of those. So is there any difference? This is for either one of you or both of you. Is there any difference for kids with kidney disease or a transplant in terms of vaccine dose and administration schedule as compared with kids that don't have kidney disease?
Well, I think we were speaking to some of that right now. I mean, dose, there is no difference. The doses are the standard doses. And, doses do vary based upon the age of the children, and Dr. Schuster can speak to that. But in terms of the regimen, again, for the immunosuppressed population, it is a 3-dose regimen, really, as opposed to 2 doses and a booster. That would really be the only difference. But Jen, you want to speak to the dosing by age?
Yeah, absolutely. So the Pfizer vaccine, which is now approved in children who are 5 to 11 years of age, it's the only COVID-19 vaccine approved for that age group in the US. The dose that's given to the 5 to 11-year-olds is 1/3 of the adult dose. So it's a smaller dose. And we're asked a lot about, if you have a very small 12-year-old or a very large 11-year-old, should they be getting a different dose? And we're used to medications being dosed that way. Vaccines are a bit different. And so they're actually dosed by age and the maturity of your immune system. So those 5 to 11-year-olds, whether you do or do not have kidney disease, are all getting the same dose of vaccine.
I'm going to bring up one question, because this has come up in my own clinic. Where we've had patients that got their first dose when they were 11 and a half years of age, or 11 years and 11 months, and then come their second dose, they're 12 years. And the question has come up: should they now get the 12-year-old dose, if you will? And I think the information from the CDC website is that indeed they should get the 12-year-old dose. But do you want to speak to that?
That's a great question. And I think there's a lot of different ways that people are thinking about this. What we're recommending, and I think the easiest thing to think about, is you get the dose that you are eligible for on the day that you are getting that vaccine. So Dr. Wardy, in your situation, that 11-and-a-half-year-old gets the 5 to 11-year-old dose. And then when you see them and they're now 12, they get that larger 12-year-old dose as well.
Good.
So we're talking about children that are living with kidney disease, but what about other children in a particular household where they may not have kidney disease? Should they also be vaccinated?
So we think that every eligible person should be vaccinated for COVID-19. So if there's a child in the house with kidney disease, they should be vaccinated, and their siblings who are 5 years and older and are vaccine eligible should also be. I think this is really important when we're talking about the transplant population or kids who are immunosuppressed for other reasons that may not respond quite as well to the vaccine. It's really important to get the other children and the adults in the house vaccinated. We talk a lot about herd immunity and how best to protect these children who are immune suppressed. Absolutely, vaccinating these children who have kidney disease is important, but vaccinating everybody around them is really important too.
And that leads into the next question that I have, and that's one that's been posed often, and it's whether, wanting to know how safe is a child after vaccination among their classmates and others outside their home?
Well, a part of it's related to how they respond to the vaccine. Do they develop the immunity that they hope to develop post-vaccine? And again, it can vary from the child who has very mild kidney disease, who likely is going to respond just like any healthy children to the vaccine. And the other side of the coin is the transplant population, who we know don't have the same robust response to the vaccine that the healthy population has. So if I look at my transplant patients that I care for, those are the individuals where there is still some risk when they go to school, if they're in a classroom where there's no masking and no social distancing. And we know, unfortunately, in schools today, all the children are not vaccinated. And so I think this raises some concern for the transplant patients and for their families, because they recognize that their own children may not have the optimal immune response, and then they're amongst other children who could be infected but no symptoms, or may not be vaccinated at all, again, and asymptomatic but infected. Jen, what thoughts?
We know that the vaccines are really good at preventing severe disease. And again, as Dr. Wardy said, in people who respond to them. So I agree. In children who have mild kidney disease and are not on immune suppression, the vaccines are great at preventing severe disease and hospitalization. We know that breakthrough infections do occur, and that's why the CDC is still recommending masking, particularly in indoor areas with high and substantial transmission. But the vaccines are really good at preventing severe disease. But this gets to the importance of why it's important to vaccinate everybody around people. And so for immunocompromised and transplant children, this highlights the importance of vaccinating everybody else in the household to decrease the likelihood that the virus is brought into the household and could infect that child who may not have mounted quite as good of a response to the vaccine.
Excellent. So you mentioned the possibility rather of increased infection. What are some of the other side effects that those children who've been vaccinated may experience?
Well, I think the children who are vaccinated, they're not at risk for increased infection. Those that are vaccinated, if they have a response, they're likely to have a decreased risk for infection. But if we focus on those children, let's say the transplant population, they don't develop, again, the robust, the normal immune response in most cases to the vaccine. So they're at risk for an infection, just, for any kind of COVID-related complications, like anybody else who gets COVID. So, I think that the thing to emphasize here is that patients who are vaccinated, especially transplant, can't take their guard down. They still may be at risk. And we don't have really good ways clinically where we monitor the immune response. And Dr. Schuster could speak to that. Some centers are checking antibody levels, but there are all different sorts of antibody levels that are being checked. So it's not sort of the standard of care to assess the immune response of the individual who's been vaccinated. And again, I think that's information that we hope to generate, over the next several months and year, so that we can have a better idea of what the risks are for the individual immunosuppressed patient. But that's really not part of the standard of care today. Jen, do you want to speak to the different, means of monitoring immune response?
And we're still learning, as Dr. Wardy said. So antibodies are the one thing that we can check. But what we've learned, there are so many antibody tests, and there's really no magic number to say if you have this antibody level, you're protected. And if you don't have that, then you are at risk for infection or at risk for severe infection. The other thing that I want to highlight is the antibodies are only one piece of your immune system. They just happen to be the one that we're able to check with a lab test. And so the vaccine trains not only your antibodies, but other areas of your immune system to fight the virus. We just don't have a great way of checking those. And so as Dr. Wardy said, we're not really doing anything or making any decisions with antibodies. One of the questions that we hear a lot is, I had natural COVID-19 infection and I do have antibodies, so do I need the COVID-19 vaccine? And what we know is that for people who have had disease, they are less likely to be reinfected if they are vaccinated, even after natural infection. So I think we'll hopefully learn more about antibodies, but they're just one piece of our immune system.
So should we presume that children who have had the vaccine but have not developed antibodies should not attend school at all?
Well, again, we don't routinely check for antibodies. So we're giving children the vaccine with the hope that they respond like we hope they do. And in the healthy population, it's generally not a problem because virtually all of them are developing response. It's the transplant population or the immunosuppressed population that's of greatest concern, because we don't really know on an individual patient basis, have they developed that robust immune response to be as protective as we'd like it to be? And so I think that's where in the immunosuppressed population, especially as we go into the winter when there's less people outside, a greater risk for infections, and there'll probably be a greater frequency of infections across the U.S. I think social distancing and potentially masking in the schools are still going to be important strategies to try to protect this group of patients.
I absolutely agree. And the one thing that I want to highlight, I think the pandemic has brought back hand washing, which as an infectious disease doctor, we really like hand washing. It's cheap and easy to do. So thinking about all those other mitigation strategies to keep us healthy. One thing that, we've talked a lot about in the pandemic, but we were really bad at doing before, is staying at home when you're sick. And so when you are sick, you're not going to school, you are not at your job, you are staying at home. And these are all things that help prevent kids not only from getting COVID, but all these other viruses, particularly influenza, which we're starting to see circulate in the United States. All of these measures will help decrease the risk of illness in these children.
And so how would parents, for example, assess sickness at a level that one would stay home? What does that mean?
So I think, thinking about symptoms that are consistent with COVID-19. So, the biggest and easiest one, I think, for parents is probably fever. That's a pretty easy one to assess. If your child is having runny nose, cough, headache, sore throat, vomiting and diarrhea, these are all symptoms that could be consistent with COVID, but they could be consistent with other things as well.
Okay. So if a teen has had the first 2 shots and then has a mild breakthrough case, how long should we wait to get them a booster from when they had COVID?
So boosters have been approved for 18 and up. The FDA actually just as of like an hour or two ago approved them for 16 to 17-year-olds. I think it will go through ACIP, which is the committee that votes on this. So I'm going to say we'll probably wait to see kind of what the final recommendations are for our teenagers who are going to be booster eligible. For our older teens, so our 18, 19-year-olds that are booster eligible, the recommendation is 6 months after the last vaccine, assuming you got an mRNA. So those are your Pfizer and Moderna shots.
But Jen, I think the question was if they have a breakthrough after their second dose, then when should they get that booster?
So so nothing has changed even with that breakthrough case, at least as of now. Now, I think it'll be really interesting with the FDA just approving the boosters for the 16 and 17-year-olds to see what additional information comes out. But for an 18, 19, or late teenagers for which boosters are already approved, there's no change in the recommendations. It's still 6 months after your last vaccine.
Excellent. Thank you. And thank you for sharing breaking news. We always want to be able to report that. So thank you very much. Well, before we get to other questions, I wanted to give both of you an opportunity to just, summarize, share with us what you think are highlights that we need as takeaways from this session today. And then we'll get on to some other questions from our viewers. So Dr. Schuster, would you like to start?
So I think, we've learned a lot in the last year and a half about the pandemic. And one of the things that I think has been incredible is how the world has really come together to make these vaccines and distribute them. I think vaccines are going to be our best weapon in our arsenal, if you will, at ending this pandemic, because they really are highly effective at preventing severe illness. And I think what we've learned is that these vaccines are very, very safe, not only in the hundreds of millions of adults who have received them, but these vaccines are very, very, very safe in children, and they are very, very effective at preventing severe disease. I'm a parent. I know lots of parents have questions. And so I always encourage parents, talk to your child's pediatrician, talk to your child's nephrologist if you have questions about the COVID-19 vaccine, but get good information from a reputable source.
One of the questions, let me just interrupt, I asked you both to speak, but some folks always want to know, is there a better shot for transplant patients? Does it matter, Pfizer or Moderna, to produce better?
I think either one of them is very efficacious. I mean, there's been a couple of studies that looked at the antibody levels that have been produced in the transplant patients, one versus the other, and one of the studies showed the Moderna levels were higher. But I think most people would recommend either one of those would be very appropriate for the transplant recipients.
Okay. And I think in terms of, if we're talking about children specifically, Pfizer is the only vaccine that is approved in the United States for our under 18-year-olds. And so to add on to what Dr. Wardy said, I would say absolutely get whichever vaccine you can get the earliest. So don't wait for another vaccine to be approved in children or, a different vaccine. Get the one that you can.
And, I think just in sort of messages so far, I think, and it just sort of builds on what Dr. Schuster just said, I think one of my messages is the message is changing all the time. We just heard cutting edge information on the potential approval for the booster for the 16 to 18-year-olds. Mm-hmm. And, we're getting more knowledge on a daily basis, a weekly basis, a monthly basis. And so the recommendations today may be different than recommendations a month from now or 3 months from now. And so people have to recognize that it's not that we, that we're changing our minds. It's just that there's new data that's being collected all the time that helps shape the recommendations and improve the recommendations. And so people just have to recognize that things may change from 1 month to the next.
And so, Dr. Wardy, was there anything else that you'd like to say in summary?
I think that's it for now.
All right. So I see one of the questions that I have here is, what about natural immunities that transplant recipients have built already by having the virus? Any comment on that?
That's a great question. So we, as the pandemic has progressed and we've seen more and more people who are infected naturally, we've also learned a lot more. And what we have started to see, and I think are increasingly seeing, is that natural infection alone leads to a higher rate of breakthrough infection than natural infection plus vaccine. I think that we saw this early on with the Delta variant in the United States, and we're now seeing it from South Africa with the new variant, the Omicron variant. We're seeing that even people who had natural infection early on are getting reinfected, which highlights the fact that even if you have had natural disease, the importance of still getting vaccinated.
Agreed.
Okay. Again, I want to encourage our viewers to submit your questions. We have some time here and would love to be able to answer those for you. We've got two leading experts here on the subject, and I don't want you to miss the opportunity to get the information directly from them. So one of the questions that we have here is, what treatments are safe for transplant patients when they do get COVID? I think we might
Well,
have
I think one of the treatments that's available in certain scenarios are the monoclonal antibodies, and Dr. Schuster can speak to that. Most of the treatment is really supportive treatment, and not so much treatment, but prevention of spreading that infection to others in the household or at school, if you will. That's not treatment for the patient. That's, again, prevention for others getting infected. But the monoclonals would be something, I think, again, in certain scenarios, are probably the most recognized treatments for COVID. Dr. Schuster, you want to speak to what those criteria are?
Absolutely. So for children, it's going to depend on the monoclonal antibody. So depending upon which monoclonal antibody you are talking about, there's different ages and weight recommendations. And some of that depends where you are geographically located in the United States as well. And then they are recommended for people who are at high risk of severe disease. So a number of risk factors. One of the biggest ones that we see is obesity. But depending upon your chronic kidney disease, you may very well be eligible for monoclonal antibody. So I think, the most important thing is if you are, or your child is diagnosed with COVID-19 and they may be feeling fine, that is wonderful. We are so happy. It's worth asking your pediatrician or your nephrologist, is my child eligible for monoclonal antibody? Because the goal of monoclonal antibodies is they keep you out of the hospital. So we actually want to give them when you are feeling fine. That is the goal. But it's always good to ask your pediatrician or your nephrologist if your child is eligible.
One thing I did want to bring up about the transplant population, again, we talked about the fact that there are medications, there are immune suppressive medications, may sort of hinder the immune response to the vaccine. One thing that we're not recommending is to modify your transplant medicines to get a better response from the vaccine, because then you're at risk for rejection and all the problems that sort of flow from that. So I think that's something that people are talking about. Certainly, I've had patients that have asked me that question: should they stop one of the medicines so that the vaccine has a better chance of responding? And the answer is universally no at this time.
Excellent. Thank you. So one of our viewers is saying that they've been informed by the hospital that some children have not had antibodies. What can they do to resume normal activities like attending school?
I think Dr. Wardy alluded to a little bit of this before. We aren't routinely checking antibodies because we know that they're just one piece of the puzzle when we think about the immune response. So I think vaccination, first and foremost, is really the most important thing. And then depending upon where you are in the country and what the community rate of spread is really being on top of all those other mitigation strategies. So at schools, as often the biggest ones that we talk about are masking, physical distancing. Many schools have made changes to their ventilation system. Some schools have implemented screening testing programs, but making sure that there are layers of other mitigation strategies in place if for some reason you're concerned that your child may not have mounted a good response to the vaccine, such as your child has had a kidney transplant.
And I've had parents of some of my transplant patients who have actually gone to the school and spoken to their teachers and said, my child is at risk because of a transplant patient. Are there things that we can do within the classroom of my child to, again, try to decrease the risk for infection? And it's amazing, the teachers and usually almost universally the other students are willing to make the change. They're willing to mask if we'll protect one of their classmates. So, I think it takes the community to try to address this pandemic that's not going away anytime soon. And I think that, you can call on your colleagues, your teachers, your friends to help, get through this in the safest way possible.
Such a great response. Thank you. So on the treatment end, are there new medicines for COVID that are safe for kidney transplanted children?
So the monoclonal antibodies are used in children, including those who have had kidney transplants. Again, there's some nuances depending upon the specific monoclonal antibody and the age and weight of the child. The new antivirals, which are frequently being talked about in the media and have gotten quite a bit of buzz, are not yet approved in children. And so we are waiting to see what that looks like. We want to make sure before we give children these medications that they're safe first and foremost, and also effective. And right now we're still waiting for that safety data, regardless of children who have kidney disease or not, to make sure that those medications are safe. So more to come. As Dr. Wardy said, everything changes at a rapid pace. So hopefully we'll know more soon.
I think one other thing to mention about the monoclonals is that current recommendation is that one should not get a vaccine until at least 3 months after that monoclonal has been provided to be able to allow it to be as effective as possible. So, if families are waiting to give their child a booster, for instance, in the older adolescent, they need to wait if they've gotten a monoclonal.
Excuse me. Aside from the vaccines, then, are there any other things that we could do to boost immunity?
So I think that one of the best things that we can do is going to be the vaccine, but I think staying healthy. So if you have chronic kidney disease and take daily medications, or if you have had a transplant and you're on daily immunosuppressive medications, I think, continuing to take those medications is going to be really healthy. So all of your other health maintenance things. So this includes seasonal influenza vaccine. For children, it includes their regular childhood vaccines, making sure that you're staying healthy, taking all the medications that your doctor has prescribed, particularly for children who have chronic kidney disease.
Great.
You said you agree, Dr. Wardy?
I absolutely agree. Yes.
Okay, great. After 3 shots, this is from one of our viewers, I only have 10 antibodies. Are there any additional shots or options to increase my antibody count?
Well, we've already talked about the limitations of monitoring antibodies, but there are, especially in the transplant world, there are going to be patients who, even after 3 doses of the vaccine, don't have a robust immune response. And I think, as I mentioned earlier, that's where there's discussions about the question about a 4th vaccine. Because we do know, especially in the transplant group, that as you go from 2 vaccine doses to a 3rd dose, you do see a significant increase in the percentage of patients who have responded. And so a patient who's had no response after 3, again, a fourth dose of the vaccine may be beneficial. We don't really know that, so it can't really be recommended at this point in time, but it's something that's being discussed certainly in the transplant circles.
Excellent, thank you. So are there any, well, here's one last question. Does dialysis impact the effectiveness of the vaccine?
No, not that we know of. I think the one thing that we've seen, and this is predominantly in the adult population, because I want to emphasize, there's limited data. There's limited published data in the medical literature on the pediatric experience with COVID-19 in those children with chronic kidney disease. But if we look at the adult hemodialysis population, we'll note that the vast majority of them do have an antibody response to the vaccine. But when you look at antibodies, the levels of antibodies are lower in the dialysis population, especially hemodialysis population, when compared to the healthy population. So I think they do respond in the dialysis population, but not in as robust a manner as in the healthy population.
Thank you. Dr. Schuster, did you have anything to add to that?
No, I think just to underscore, I think that this is going to be an area in particular with dialysis that we continue to learn as the pandemic evolves. And this is why I think it's so important to continue to check in with your nephrologist, your child's pediatrician, to find out, have recommendations changed? Are there new things that, we should be doing in terms of vaccines or preventative strategies?
Excellent. Well, I wish we could go on talking about this today, but we are just about finished here. And I want to thank you both, Dr. Wardy and Dr. Schuster, for your time today. And in case we did not get to your questions, please go ahead and check back on the National Kidney Foundation's Facebook page, where we'll be posting the answers throughout the coming days. So again, thank you, Dr. Schuster. Thank you, Dr. Warady, for joining us and sharing all of your great information on this very important topic. Thank you both so very much.
Thank you.
Thank
Enjoyed
you.
it. Bye-bye.
And so on behalf of the National Kidney Foundation, thank you, and I'd like to wish you all good health. Thank you so much.